Hello friends, welcome to my channel Breathful Lung Care because every lung and every breath matters. In a short lecture series, Must Know Classical Science in Thoracic Radiology, in today's lecture, I would like to discuss a very important sign called as double density sign. So in that, I would like to discuss what is double density sign, how it looks like, how to identify double density sign radiologically, and what are the conditions in which double density sign is present. So let us start with the today's sign, double density sign. What is the double density sign? So when there is a left atrial enlargement because of any reason, it appears as a curvilinear soft tissue density in the right retrocardiac region in the chest radiograph. And this curvilinear density along with the right atrium opacity represents the double density sign. So when there is a left atrial enlargement, it appears as a soft tissue curvilinear line in the right retrocardiac region in the chest radiograph, which appears as a double density. That's why it is called as the double density sign. In very severe cases, this curvilinear density of the left atrium may even project beyond the right atrial border, which is called as the atrial escape. So sometimes because of the left atrial enlargement, this curvilinear density of the left atrium even projects beyond the border of the right atrium, and this is called as the atrial escape. Once visualized, one should look for the other signs of the left atrial enlargement. So these other signs are the carinal widening, elevation of the left main bronchus, and enlargement of the left atrial appendages. So when there is a left atrial enlargement, we have to look for the other signs of the left atrial enlargement. So very important other signs are carinal widening, elevation of the left main bronchus, and enlargement of the left atrial appendages. Let us discuss with very simple example. This is a chest X-ray PA view of a 45-year-old female. She presented with the difficulty in breathing and diagnosed with the mitral valve disease. The PA chest radiograph of this patient showed a double density behind the right heart with the two separate borders due to the right atrium, which is shown here with the white arrowhead, and left atrium, which is shown here with the white arrow, which producing a radiologic sign which is called as the double density sign. You can see here, because of the left atrial enlargement, you are able to appreciate the left heart border here, and this is a right heart border, which creates a double density. That's why it is called as the double density sign. Also, because of the enlargement of left atrium, there is a carinal widening, as well as there is a elevation of the left main bronchus and the enlargement of the left atrial appendages, which is shown here with the. This is all about the double density sign. I hope you all understand what is double density sign, and you will be able to identify the double density sign radiologically, and this will definitely helps in the diagnosis. So please like and share this video, and please subscribe to my channel. The next lecture I'll be back with the one more very interesting sign. Till then, bye bye. Thank you so much.